Today we're gonna have 4 teams presenting their MVP. So the question that we propose to you is to present your MVP in a critical but succinct way. So in 5 minutes, you're gonna be presenting the project one-liner, and then you're gonna go into explaining what your current prototype that you're looking feedback for, and then you have like open up for 1 to 2 questions that you're seeking feedback on. So like what is your prototype presenting? So is it like the website that you're presenting? You know, is it, what is it in particular? And then what is the feedback that you want to get out of here? So for example, for us in IMAGINEi5, our project one-liner is IMAGINEi5 is a creative consultancy for social impact innovators, accelerator, and incubator. So our current prototype consists of weekly workshops for COVIDAccelerator via Zoom, so like here, what we're doing right now. And then you can expand a little bit on that explanation. And then with the feedback that we're seeking is what aspects of the workshop have been successful and what needs more improvement. So like our product itself is the workshop Zoom via Zoom. So that's the exact product that we have. And so hopefully it is clear enough for the teams to be able to present in that way. So without taking any longer, let's go into our teams and let me present you. So these are our 4 teams that we're gonna be hearing from today. Today is a packed house. We have 4 teams presenting. So thank you so much for reaching out and wanting to present. So we have KellyAnn Kelso presenting about pulse and process, which is she's sharing a blog and really awesome stories about communities resilience. My family and I worked with her into one, and it was a fantastic experience for us. So Kelly, if you have presenting rights, if you want to share something.
Oh, thanks. Yeah, I can. Why don't I just go ahead and drop it into the chat, the website itself, so you can just go. That's cool.
Okay. Yeah.
So, and process.com. So raise your hand if you happen to have already seen the website because you were on a previous call. All right, cool. So 30%. Thank you. Basically, the purpose of the blog, and that is the prototype. It's a blog. It's a website. That's it. It's kind of in the title. It's anchored in COVID stories. Really, the initial concept was around, and I've seen increasing numbers of people pursuing something similar, to hear from individuals themselves as individuals who had been impacted by COVID, which kind of is universally applicable, but to hear from a more diverse audience than I was seeing come up in the news, for example, tell their story firsthand and just hand the mic to them and ask a couple of thoughtful questions to try and elicit some acknowledgement of A, their experience, and B, some reflection on how it had begun to change them. And the purpose was really just a low-tech, longer-term vision of there's really no going back. And so you need to acknowledge and process something in order to integrate it into your new life. I think the question I'm really excited and grateful to have the opportunity to consult some members of this group on today is, really the purpose of the blog was diversity of perspectives. But if you look at the ultimate posts there, they kind of follow one sort of very obvious phenotype. And that's for some reasons our lack of having additional folks talk with me. The other is just clerical. So for example, Adriana's family, who I interviewed, was phenomenal. It was a phenomenal conversation. They are bilingual and they spoke in Spanish for this interview, which I welcomed. And I've done my best to translate the Spanish recording to an English transcript and then go back to Spanish and create a bilingual post. But that's been a great deal of overhead for me. So that hasn't gone out, and that's a disappointment. So I love some help with ideas for that. And then the other thing is, this is a very free form idea where I just launched it and I didn't care to inform the question too much. But now I really want to measure for impact. I really want to evolve the website to have a couple of maybe engagement surveys at the end of a post, like, what did you get out of this? Where's the direction I should continue to pursue, and make the ultimate impact of that a little bit clearer. So those are my main two questions for today. Any questions before we move on?
So thank you so much for sharing, Kelly.
Yeah.
You have done an awesome work. Like my family itself, just having the conversation was like that was the event for them. So yeah, continuing that work and yeah, testing it out, like it is amazing.
So our project is farm community, and like Adrian said, started here in northern New York in Lewis County with a simple idea. One generous farmer that lives near me, she saw a bunch of eggs that were for sale dirt cheap because the farmer was unable to sell them to the restaurants and schools that they usually sell them to. So she bought 230 dozen of them at like 10 or 20 cents a piece and donated them to the school meal delivery program. So our project was formed around that idea to see if we could expand and build on that. So Farm to Community is a growing community raising funds to support local farmers during the difficult time they're having in the pandemic, prevent food from going to waste, and get more local foods to those that need it. Just to kind of set the context up front on what we're looking for feedback before we go through the prototype and the rest of the slides, we're really looking mostly for feedback on getting advice on a more sustainable model beyond fundraising. Currently, we're doing like GoFundMe fundraising, which I'll talk more about, but we're looking on moving to something that's more sustainable long term. And then also growing our impact and expanding, helping people to replicate this in other regions, but at the same time, keeping in mind that we have, full or part-time volunteer team. So we have to work within that constraint. So our prototype is really here in Lewis County. We've been using a GoFundMe campaign. We set up a Facebook page, an Airtable sign-up form. We have a Slack-based community, kind of similar to Accelerate, smaller scale, focused around farm to community. And we have weekly Zoom meetings. And then we put up a website, farmtocommunity.com, to kind of tell our story and gather interest in people interested in implementing this in other areas. So the progress that we made so far, we've raised about $3,800. We have 826 Facebook followers, about 20 volunteers. We started with the South Lewis School District, and we're expanding to a second school district in the area. We've delivered eggs, maple syrup, cheese sticks, milk, radishes, and beet greens in the past couple months since the pandemic started. Here's some pictures of one of the maple syrup deliveries that went out with pancakes that the school was delivering to the students, and a milk delivery. So we added gallons of milk to the meals that were being delivered to the school. So how do we make the greatest impact? Our current plans are continuing to evolve in Lewis County, which I'll explain a little bit more about. And then our other approaches to kind of open source the approach that we've taken to farm to community so far, knowing that we don't really have the bandwidth to kind of be the gatekeepers to this whole thing. We want to reach as many people as we can with this, help as many farmers and as many families as possible. So we're working on documenting a playbook around, how we've done this, the tools and existing technologies that we've used, so we can share that with other people and help them get it up and running in their community. So as for evolving in Lewis County, we're looking at some different models. One is during the summer, we expect the amount of support for the families in need in our area to be dropping or going away a lot. A lot of the school meal delivery programs are going away, or they're no longer doing deliveries. It'll be pickup only. SNAP assistance is going to be going down, and the extra unemployment is ending, I think, at the end of July. So we're looking at a voucher program with our local farmers markets, where we can fund these vouchers to go out to the families, maybe $5 a week or so, to enable them to go get fresh foods from the farmers market. So it's still supporting the farmers and the families that need it in the area. And we're also working on a t-shirt fundraiser with someone in the community, and she's designed this t-shirt for us, and every one of those sold for $15, we'll get $5 of that to use towards our cause. As for open sourcing it, like I mentioned, we're working on putting together a playbook just to document what we've done so far and how people get this up and running if they're interested in doing a similar thing in their area. So we're capturing, you know, what the typical team roles and responsibilities are, the tool set that we've used, and how to get it up and running. And then we can promote those other initiatives underneath our Facebook page and our website to help get them more visibility. So like I mentioned in the beginning, we're really seeking feedback on moving to more sustainable models beyond fundraising. Our thinking is that, you know, as people tire of the pandemic and interest in that goes down, that fundraising really over the long term isn't going to be sustainable. We're still getting some donations. We got another donation for $300 today, but we can see that it's tapering off. And then just suggestions on how to grow our impact. Like if this, you know, approach of open sourcing makes sense, we would like to, you know, get this out there and share what we've done with more people across the country, if possible, and just help more farmers and as many families as we can.
Awesome.
That's it.
Thank you so much.
Thank you.
Yeah. Thank you
Absolutely.
for the good information about farm to community with infodemics in Africa. And he's looking to expand into the African community, and hopefully with PHAGE on board, we can figure out ways to help you out as well. So go ahead, Steve, if you have anything to present.
Yeah, for sure.
Can present.
I'll just quickly share my screen. Hello, everyone. I'm really happy to be here today. Can you see my screen? Perfect. Okay. So I'm Steve Tchuente. I'm an MBA candidate at HEC Paris, and I'm representing the Accurolab team. On the channel, we also have Tariq. Tariq, if you can jump in just to say hi to everyone.
Hello, everyone. I'm Tariq. Thank you for having us.
Okay. So I will go quickly. So I will just quickly present you what we are trying to achieve within Accurolab in terms of what was our key problem, the key problem we defined already 6 weeks ago, and also what are the key steps we would like to cross in the next coming days. So actually, globally speaking, the context and the problem space is when the coronavirus crisis started in Africa, in addition to, I think also in the world, in addition to the epidemic, the pandemic itself, we also had to face a new kind of pandemic called the infodemic. And actually, fact-checking information and accessing verified source was a very crucial part of being well-informed during the pandemic. And it still stays, it's still something that we have to keep in mind, even when so many countries are getting back into the new normal. And this is exactly what we're trying to achieve. So these are some examples of messages that were shared on social media, such as Facebook, WhatsApp, in Africa, but also elsewhere in the world. And for example, when you look at some messages such as the virus does not withstand heat and dies at exposed temperature of more than 26 degrees Celsius, this is really dangerous for people living there, because that actually is a sign. If you receive this kind of a message on WhatsApp, you don't actually know if it is true or false. And if you decide to follow it, that means that you're actually jeopardizing your own health, but also the one of the people around you, because you won't actually be applying the social distancing rules. And so our problem statement was actually to put in place a solution that will allow the African smartphone user between a given range of age to be able to fact check the information they were receiving on social media and to stay well informed and safe during the pandemic, but also after. So globally speaking, our solution is actually come with 3 key goals. We want to give the possibility to the user to verify the information they are receiving by fact checking it. We want them to have the possibility to extract very straightforward information from the regional, global, and local health authorities about how to fight against the pandemic. And at the same time, we want them to be able to receive statistic information, new guidelines about how to fight the pandemic in their local communities. So this is our solution. It is a Twilio-based algorithm that we empower with a natural language processing system. And it's actually based on 2 key functionality. The first one is the fact checking that I presented before. And the second one is much more something we call a crisis compass, meaning we want to give information to the different people in Africa and those local communities to go through the crisis with having this good information. And for the first version of the product, we have decided to focus on 4 key components, meaning the causes and the transmission modes of the coronavirus, the symptoms, the treatment and the prevention, and finally the statistics. So I'll quickly show you the demo of the fact-checking process. So this is how it works. So a user, let's say a user have received a given piece of information on WhatsApp, and he's just wondering, is this information true or false? So actually the user can just send it to Accurolab, and then Accurolab will be able to kind of screen into the message, identify what is the message about. Here he was talking about going out during the pandemic, and kind of come back to the user with a very list of key and very specific guidelines about what he has to do to stay safe during the pandemic. The second functionality is much more a dissemination tool that actually allow the user to kind of receive from the different health authorities some guidelines about how to stay safe during the pandemic. So we are currently we have decided during the first step of the project to mainly focus on the first functionality, which is the fact-checking. So this is globally the planning we have been following. And right now we are preparing the version 2 of Accurolab. And these versions currently quite ready. We'll be able to actually push it to our beta tester user, around 40 user. And these versions currently able to fact check on the 4 categories I mentioned before, and also it's already been populated with around more than 80 content in terms of prevention, in terms of symptoms, in terms of what are the key guidelines to follow during the pandemic. So following the beta testing that we are planning for the end of this month, our key goal is actually to scale up, to adjust into impact, and really to go into a pilot phase. And this is really where we will need your feedback in terms of, we want the product to be available to different people. We want the product to be available mainly for people in Africa, but it can be also used used by other people in other collectivity speaking English. And we are now thinking about what is a good way for us to go on the market and to actually have the much more big social impact for the people on the ground. Yeah. So globally speaking, that's it. The team, we are a team of 6 quickly. We are based on 4 different time zones, from the US to France and Nigeria. And we are all working hard since early May to kind of make the project be ready for the end of this month and to have it being delivered to the user on the ground.
Perfect. Thank you, Steve. Great work.
Yeah, so PHAGE Corporation, the entire focus is to equip patients and caregivers to be shared decision makers throughout their complete healthcare journey, to learn how to advocate for themselves as they go through insurance, care settings, and all that excitement. So we're developing a global solution, but our MVP for this pitch will be very US-centric, while still trying to think about the market dynamics that are happening globally. So navigating healthcare is very confusing, and it's only getting more expensive, and a pandemic isn't making any of that easier. The market's going more towards value-based care, making sure that the health outcomes are tied to reimbursement, and we're not really set up to measure that because we don't have a comprehensive understanding of patient outcomes. Adding a layer of COVID-19, let's say you and I developed COVID-19 infection, and we go to a hospital and get a diagnostic. If we get a diagnostic and we go home, and one of us dies, we actually aren't really tracking that death rate because it's happening outside of the EMR system. And unless you're scraping obituary data, we miss a very easy to find patient outcome of death. So what's happening for the other 97% of people that get infected that don't die? We're not thinking about any of their outcomes, and going forward, they're going to present very similarly to how SARS and MERS patients are developing long-term outcomes. So measuring death shouldn't be difficult, it is. Measuring outcomes besides death just gets to be even more confusing. And even with some innovations of dexamethasone, which came out just a couple of days ago, you can see that this is stuff we should really be focusing on in a very live fashion. So what we do at PHAGE Corporation is research clinical and health economic outcomes and help guide study designs or help map routes for patients to have access. And that's why we're developing a patient user and caregiver user facing application, not only to help guide them through managed care, as well as to start measuring better outcome data. A lot of data science, we only have 5 minutes, so we'll skip that. But if you're thinking about COVID-19, we don't really have a treatment specific to prevention, like a vaccine or anything about long-term outcomes. So really you have to equip patients with behavioral intelligence. This can be breathing modalities. This could be PPE. This could be social distancing. There's so much you can do, even if you don't have a treatment in place. It's really around the diagnostic journey, antibody, antiviral, PCR, genetic testing, viral particles. There are so many ways to test a patient, but measuring it to an outcome and knowing what's the right thing for the right patient is a lot of onus to put on a user. So we help them from a regional context as well as the stage of their patient journey to match health literacy to what's around their regional environment. We're able to do this because our COVID-19 experience is not too dissimilar from our oncology experience. So this is when there's a product that's $475,000 to get access to. So you can use the same frameworks because the patient journey is very dissimilar from cancer to COVID-19, but how you go get treated, how you go get diagnosed, how you use your insurance or how you don't use your insurance, that's a very consistent and somewhat difficult journey to put on a patient that's sick while they're also trying to figure out how to use their insurance and how to use healthcare. So the entire reason we're doing any of this, besides collect better data, is to really allow patients to be a true stakeholder and a knowledgeable healthcare consumer, as opposed to just being a product for everyone else at the end of the day. So a live dashboard that provides real-time experience, supplies, patient direct support, and allowing us to actually provide value for the patient along their entire lifetime, as opposed to just when they're sick. So we can make sure that they're utilizing the resources that are available and not just, dying without measuring their outcomes. So a summary of our solution is that we have a very guided patient journey on the left side, which seems very convoluted, but for a patient, they actually only go through a few steps. They don't go through that entire journey. They go through a very patient-centric route. So we save them hours of Googling. We save them hours of knowing what to do with that Google knowledge and help them do it in one complete environment while also tracking their outcomes from every stage. And then doing better data science, start coupling those outcomes to health economic outpoints. For patient outcomes, it can be very simple as a functionality score, the agency of them to care for themselves, or something like the quality of life. Are they even able to swallow while they have head and neck cancer, do the chemotherapy? So an outcome of not being on a feeding tube or having very high nutritional caloric content is an outcome that's important. That's not really the primary endpoint for most of our efforts. And just patient outcomes is one tiny section of the data we're collecting, but I think patient-reported outcomes is the most neglected and the most useful to start tying economical endpoints to this as well. So the summary is we're helping fill the bridges of the knowledge bases already out there. And the reason that we're interested in this conversation is because all of us on the call right now are healthcare consumers. We're all patients and we're all living in a COVID-19 world. So getting perspectives on your interests, what you would like help with, and kind of what's the sticky point that you find that the existing products out there are not servicing you is kind of our ask in this conversation.
We're gonna talk a little bit about Troika Consulting. So Clarice, go ahead.
So thanks, KellyAnn, for introducing us the Troika Consulting, which is a very powerful, liberating structure that helps people gain insights on issues they face and unleash local wisdom for addressing them. In rapid rounds of consultation, individuals ask for help and get advice immediately from mentors and peers. The purpose of exercise is to refine skills in asking for help, learn to formulate problems and challenges clearly. And for mentors, it's an opportunity to refine listening and consulting skills and develop ability to work across disciplines and functional areas. It's also a way to build trust within the community through mutual support, build capacity to self-organize and create conditions for unimagined solutions to emerge. So how can we make this work? Step one, client will share what is their challenge and what kind of help they need. And mentors ask clients clarifying questions about their needs. Step three, client turns camera off and are encouraged to take notes. Step four, consultants have a conversation and generate ideas, suggestions, and whatever else they might come up with. Step five, client turns camera on. Step six, clients share to the consultants what he or she could take out of the experience. For consultants, which is made of mentors and also COVID and COVID participants, coaching and mentoring skills will be utilized during the session. During the step 1 is the perfect place to practice active listening. As a consultant, you have to focus on your client fully and don't get distracted by your own thoughts and environment. Then step 2, another aspect of coaching comes into play, asking clarifying questions to gain further knowledge about client situation. For example, who else is involved with the part that's not really clear, what else? The questions used here work best when they are powerful ones, not directing the client in any direction, but only revealing the information. During step 4, as soon as the clients turn down their camera, the stance of consultants change from coaching to mentoring. As mentor, you will elaborate on the situation of the clients. You will exchange thoughts and ideas on how to handle it and share the experience you have made in similar situation. Sticking to mentoring means that telling what to do is usually not the best option. A mentor lets a mentee benefit from his experience, but is very well aware of the fact that in complex environments, one-size-fits-all approaches won't work. Therefore, a mentor makes offers and probes whether something feels useful or applicable for his mentee at the very same time. This is what happens in Tchuente consulting when the client shares back his takeaway in step 6.
Thanks, Clarice. I just wanted to clarify, that was really great job going through those steps. Just wanted to clarify, this is a suggested method of when we break you out into rooms, how you can perhaps ask for feedback and get feedback. So we sent the slides out so you can see these steps, and this is just to encourage a particular structure, a liberating structure during your session.
So now we're breakout in, we are entered the breakout rooms. We have 4 teams work on MVPs, and we have 15 minutes for the work session.